Why is sputum culture not always available for TB diagnosis? Imagine trying to catch a rare butterfly. Sometimes it's just not there when you look, and that's similar to why sputum culture isn't always available for diagnosing tuberculosis. Sputum culture is a key test because it confirms the presence of live bacteria and helps determine if the bacteria are resistant to drugs. But many factors can make it hard to use this test for everyone. First, not everyone with tuberculosis can produce enough sputum to test. Sputum is the mucus you cough up from your lungs, but some people, especially children, people living with HIV, or those with early or mild symptoms, might not be able to cough up enough. This is called sputum scarcity. Studies show that nearly 1 in 5 people with tuberculosis can't provide a good sample. When sputum isn't available, doctors might try other methods like induced sputum, which uses saline mist to make coughing easier, or more invasive procedures like bronchoscopy, where a tube is inserted into the lungs. But these options aren't always possible, especially in places with limited resources. Second, the quality of the sputum sample matters a lot. For the culture to work well, the sample should contain mucus and pus, not just saliva. If the sample is poor quality, it might give a false negative, meaning the test says there is no bacteria when there actually is. Sometimes, even a saliva sample is accepted if no better sample can be obtained, but this can reduce the accuracy of the diagnosis. Third, performing a sputum culture requires special laboratory facilities. Growing the bacteria takes several weeks and needs biosafety level 3 labs to prevent infections among lab workers. Many countries with high tuberculosis rates don't have enough of these labs or trained staff. Transporting samples from remote clinics to these labs can be tricky too. Samples might degrade during transport, which lowers the chance of detecting bacteria. Fourth, sputum culture takes time, often several weeks, compared to faster tests like smear microscopy or molecular tests such as GeneXpert. While culture is the most accurate way to confirm active tuberculosis and check for drug resistance, the delay can be a problem when quick treatment decisions are needed. Doctors often start treatment based on faster tests and wait for culture results to confirm and guide therapy. Fifth, patient and healthcare system factors also play a role. Some patients may not return to give a second sputum sample, which is recommended by the World Health Organization. Others may have atypical symptoms that make diagnosis harder. In hospitals, if initial tests are negative, clinicians might stop precautions too soon, even if the patient still has tuberculosis that wasn't detected initially. Finally, the availability of sputum culture depends on resources. It is more expensive and complex than other tests. In many places with limited budgets, culture and drug susceptibility testing are reserved for complicated cases, like when treatment fails or drug resistance is suspected. This means many patients are diagnosed and treated without the benefit of culture results. In summary, sputum culture isn't always available because of patient issues like difficulty producing sputum, logistical challenges, such as lab access and sample transport, the time it takes to get results, and resource limitations within health systems. While it remains the gold standard for confirming tuberculosis and checking for drug resistance, these barriers mean many patients worldwide are diagnosed using other methods. Improving access to faster, easier, and more reliable diagnostic tools is essential to better manage tuberculosis everywhere. Always remember, if you or someone you know is being tested for tuberculosis, consulting healthcare professionals is the best step for personalized advice and treatment.